Edema is a medical condition characterized by swelling caused by the accumulation of fluid in your body's tissues. This can happen in various parts of the body, but it's most commonly seen in the legs, ankles, feet, arms, and hands. In some cases, the fluid buildup can occur in the lungs, abdomen, or even around the eyes. Normally, your body maintains a delicate balance of fluid in its tissues. The blood vessels carry fluid to tissues throughout the body, delivering oxygen and nutrients. Some of this fluid naturally seeps into the surrounding tissues. Usually, this excess fluid is collected by the lymphatic system and returned to the bloodstream. Edema occurs when this balance is disrupted, either because too much fluid is leaking out of the blood vessels or because the lymphatic system isn't working efficiently to remove it. So, it's important to note here that edema is not a disease in itself, but rather a symptom of an underlying condition or a side effect of certain medications. Types of edema. There are several types of edema, each with its own characteristics and causes. Number 1. Peripheral edema. This is the most common type, causing swelling in the legs, ankles, feet, arms, or hands. Number 2. Pulmonary edema. Here, fluid accumulates in the lungs, making breathing difficult. It's often caused by heart problems like heart failure, or can result from high altitudes or lung injury. Number 3. Cerebral edema. This occurs when fluid builds up in the brain, leading to symptoms like headaches, confusion, or even seizures. It can be caused by trauma, infections, or strokes. Number 4. Macular edema. In this type, the swelling occurs in the macula, which is a part of the retina in the eye. This type often occurs due to diabetes or eye surgery, and it can affect vision. Number 5. Lymphedema. This is a type caused by damage or blockages in the lymphatic system. It usually affects the arms or legs and can occur after cancer treatment or surgery. Causes of edema. The causes of edema are diverse and can range from benign, temporary conditions to serious underlying health problems. One of the most common causes is simply gravity. When you stand or sit for long periods, gravity pulls fluid down into your legs and feet. This is why many people experience swollen feet after a long day of standing or sitting. Another common cause is eating too much salt in your diet, as salt can cause the body to retain water. Pregnancy is another common cause of edema, particularly in the later stages. As the uterus grows, it can put pressure on the veins that return blood from the legs to the heart, leading to fluid retention in the legs and feet. Additionally, hormonal changes during pregnancy can also contribute to fluid retention throughout the body. Certain medications can also cause edema as a side effect. These include some blood pressure medications, nonsteroidal anti-inflammatory drugs, steroids, and some diabetes medications. Calcium channel blockers, used to treat high blood pressure and heart conditions, are particularly known for causing edema in the legs and ankles. Heart problems are another significant cause of edema. When the heart isn't pumping efficiently, blood can back up in the veins, leading to fluid buildup in the tissues. This is why people with heart failure often experience swelling in their legs and ankles. Similarly, kidney diseases can cause edema because the kidneys play a crucial role in regulating the body's fluid balance. When they're not functioning properly, fluid can accumulate in the tissues. Liver disease, particularly cirrhosis, can also lead to edema. A damaged liver produces less albumin, which is a protein that helps keep fluid in the bloodstream. With less albumin, fluid is more likely to leak into the tissues. Liver disease can also cause fluid to accumulate in the abdominal cavity, a condition known as ascites. Another cause of edema is venous insufficiency, which is a condition where the veins have trouble sending blood from the legs back to the heart. This can be due to weak or damaged valves in the veins. Finally, we have lymphedema. This is a type of edema caused by problems with the lymphatic system. This can occur after surgery or radiation therapy for cancer, particularly breast cancer. But it can also be a congenital condition, which means you're born with it. Before we continue, if you have been finding the video helpful so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Symptoms of edema. The most obvious sign of edema is puffiness or swelling of the affected area. In peripheral edema, This is often most noticeable in the legs, ankles, and feet. The swollen area may appear shiny or stretched, and the skin might look puffy or doughy. Also, if you press your finger into the swollen area, you might notice that an indentation, or pit, remains for a few seconds before the skin returns to its normal shape. This is known as pitting edema. People with edema often describe a feeling of heaviness or fullness in the affected limb. The swollen area may feel tight or even painful, especially if the swelling is severe. In some cases, the swelling can make it difficult to move the affected body part. For instance, severe edema in the legs can make it challenging to walk or fit into shoes. When edema affects the hands, it can cause rings to feel tight or even get stuck. People might notice that their watch band feels snugger than usual. In facial edema, the face may appear puffy, particularly around the eyes, especially in the morning. In cases of pulmonary edema, where the fluid is in the lungs, symptoms can include shortness of breath, difficulty breathing, especially when lying down, wheezing, and a cough that may produce foamy sputum. These symptoms can be particularly severe and may come on suddenly. Diagnosis of edema. Diagnosing edema typically starts with a physical examination. Your doctor will look at the swollen area and check for signs of pitting edema by pressing on the skin. They will also ask you about your medical history, any medications you're taking, and whether you've had any recent injuries or health problems. Depending on the suspected cause, your doctor may order additional tests. These might include blood tests to check kidney and liver function and to look for signs of inflammation or infection. Urinalysis to check for protein in the urine, which can be a sign of kidney problems. Chest X-ray or echocardiogram if heart problems are suspected. Finally, ultrasound of the legs to check for blood clots or venous insufficiency in the case of peripheral edema. Treatment for edema. The treatment for edema depends on its underlying cause. In many cases, addressing the root problem will help resolve the edema. For mild cases of edema, especially those caused by prolonged sitting or standing, simple lifestyle changes can be effective. Raising the swollen limb above the level of your heart can help drain the excess fluid. For example, if your legs are swollen, you can prop them up on pillows while lying down to reduce the swelling. There are also special socks, sleeves, and stockings that can help prevent fluid from pooling in the legs and feet. These garments apply pressure to the swollen area, improving circulation and helping to reduce swelling. These can be very helpful, particularly for edema in the legs. Other than that, reducing salt intake can be also beneficial, as excess sodium can contribute to fluid retention. For more severe cases, diuretics, often called water pills, might be prescribed. These medications help your body eliminate excess fluid through increased urine production. However, they should be used under medical supervision as they can affect the body's electrolyte balance. Exercise, particularly activities that engage the muscles in the affected area, can also help pump excess fluid back into the circulatory system. Swimming is often recommended as it provides gentle resistance while also benefiting from the pressure of the water. Finally, for edema caused by serious underlying conditions like heart failure or liver disease, treating the underlying condition is crucial. This might involve medications, lifestyle changes, or in some cases, surgery. At the end, edema may seem like a minor annoyance at first, but it's important to recognize when it could be signaling a more serious health issue. So, if you notice persistent or severe swelling, it's always a good idea to consult with a doctor to determine the underlying cause and get the appropriate treatment. Now we want to hear from you. Have you ever experienced edema? What was the cause of it, and what treatments or lifestyle changes helped you manage it? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.